Hi yogis, those in need of recovery, those who are in recovery, those who know they will need recovery in the future. This is Nancy Cellini, and I have a practice called Just Breathe Yoga Therapy, clinical yoga therapy. And it is the application of yoga, as those of you who have been watching these videos know now, to the process of growing stronger and relieving pain and discomfort in the body. So I had done a really lovely video for all of you 2 days ago, but ran into some technical difficulties. So I'm going to bring you this one today on my 2-week anniversary, meaning 2 weeks yesterday was to the day of my surgery. And you may notice I'm coming to you from a little different perspective today. I am standing. I have gone this morning for my medical clearance appointment with my primary care physician for my shoulder surgery on Thursday. But you notice I am standing upright, and I thought I would just bring you a very short, brief piece today about the importance of getting moving. When you've suffered an injury and you're in pain, sometimes the last thing you want to do is entertain this thought of getting up and getting moving. But I am here to tell you that it's probably the most important thing you will ever do. So even based on what we've been covering in this little series about beginning your practice seated, beginning with some mindful breathing to get started, closing your eyes, allowing your inhalation to a certain count and your exhalation to a little longer count, and then setting your intention. So assuming I've done all that, one of the things I've been doing every day is a standing practice, and I do my standing practice 3 times a day. I'm not going to go through all of it, but if you can't do a standing practice 3 times a day, or you don't know what that is, even just the simple act of getting up and down from a chair, right? And I'm just simulating now, nice area of balance, using both my feet to rise up, and with the breath, something this simple would look like. And I do that 5 times, and then I rest, and then I do it another 5 times. So I'm incorporating that ability to get up and down out of a chair or up and down from a bed into my practice every single day. If you can stand and you have the agreement of your doctor or your professional healing team that standing is a good thing for you, it gets the blood moving. I can feel my feet planted firmly underneath both hips, and it's just a very freeing place to be, because I think if we know that we can stand and walk and move, it adds a whole new breath of fresh air and perspective to the healing process. So that's all I have for you today, other than continuing to be very thankful, very grateful. Healing comes to each individual in a very unique way. Again, remember, I've been stressing every week to make sure that your healing journey is done with the guidance of people who you really trust in the way of your healing professionals, be they doctors, nurses, nurse practitioners, orthopedists, chiropractors, Reiki masters, that list goes on and on. I am one of those people who believes that multidiscipline, multi-approach is the very best thing. But when you are first coming out of a very serious injury, being realistic about what you can do and being thankful and grateful for whatever that capacity is really important. 2 weeks ago, I could barely move. Today, I'm doing laps around my kitchen counter, and I'm doing a standing about a 5 to 10 minute practice about 3 times a day, combined with physical therapy, combined with meditation, love, and as much positive thought as I can muster. And I am far, far, far from perfect on that. I have my moments, and we must go through the stages of our personal grief, because an injury can be looked at very similarly to the way we deal with loss. It's loss of freedom, it's loss of ability in some cases. But as we said in the beginning, think about what you've gained. Think about your new perspective. Think about how there are certain things in life you may never ever take for granted again. The simple act of being able to get up and get yourself to the bathroom and wash your face and brush your teeth. These are all little gifts along the way. So I'll be back during the week prior to my surgery, and then I'll absolutely be back with progress updates on the shoulder, which is Thursday, the 23rd of July. I will ask you all to send me brilliant, white, healing energy. God's power and your prayers and thoughts will be very much appreciated. But I'm getting there, and we'll all get there together. Thank you, everybody, for spending this time with me. Namaste.